Welcome back to Champion News Talk Radio, brought to you by championnews.net. This is Carol Parisi. Our founder, Jack Roser, and myself have C. Stephen Tucker. We are talking about Obamacare, and we were talking about Medicaid expansion. Now, Steve, you were saying something, there's a change in the law to pre-existing conditions, and that's a pretty big deal for our listeners. What does that mean to them?
Huge deal. Okay, first of all, if you remember, the president ignored the fact that we have already had 35 high-risk pools for individuals with pre-existing conditions on a state level. In Illinois, we call it the Illinois Comprehensive Health Insurance Plan.
How long has that been in play for?
More than 2 decades. It's been around for a very long time. And it is a place where people who are sick, who can't get coverage for individual health insurance, because they're the only people that face pre-existing. People on group health insurance under 1996 HIPAA law, that's 90% of the American insured, never have to deal with pre-existing so long as they keep consistent coverage. But when Congress passed that law, they extended no coverage for pre-existing conditions or portability protection between policies to individual policy holders. Today, that's 14 million Americans. So when they dropped the ball on the federal level, the state insurance departments, like Illinois, said, hello, United Healthcare, hello, Humana, hello, Aetna, Cigna. If you come into our state, we want a percentage of your profits every year. We're going to put that into a pool for sick people to get health insurance on a guaranteed issue basis. We did this for decades.
That actually sounds smart.
It's very fair.
A percentage, then it's not on taxpayer, it's on health insurance.
And they get a little bit of a taxpayer grant every once in a while from the federal government, but it's very small. And this has been our solution for many years on a state level. Well, the president didn't tell the American people that those things exist. He said, if you're denied for coverage, you have no options, it's cruel, whatever. Okay, so the law has been changed now fundamentally since Obamacare passed. When Obamacare passed, if you remember, they would let you wait until you're sick, right? Then buy a policy, keep the policy for as long as you need treatment, cancel the policy, because why would you keep it if you can get it when you get sick again?
Right.
This is what Mitt Romney did in Massachusetts. And when Governor Devil Patrick took over, looked at the situation, said that we can't do this. Insurance companies are going bankrupt, they're leaving the state. We've got to more emulate what group health insurance does. In my first speech to the Chicago Tax Day Tea Party in 2010, the rally we had down in Daley Plaza, I said the way to fix pre-existing conditions is not 2,700 pages, one sentence. Add one sentence to existing HIPAA portability law that says all individual policies are now protected under existing HIPAA portability law. Okay? Simple fix. They did it in 2011. HHS adopted that, made it official in 2012, and so now what's going to happen is you can no longer game the system as the law was written, where you can wait till you're sick and buy. Okay?
Good. Well, actually, that's a good thing,
Which is an improvement, but don't get me wrong, there will still be adverse selection. Here's what happens. Starting October 1st, you will be able to buy health insurance in the exchanges from any carrier in the country that is selling insurance in the exchange. They cannot deny you coverage for pre-existing conditions. The first open enrollment period, open enrollment, where have we heard that before? Group policies and Medicare for Part C and D, right? So it's going to emulate that. Only the first open enrollment period will last longer than 10/1 to 12/31, which is where most open enrollment periods are for Medicare today, 10/15 to 12/31. First open enrollment period will start 10/1 and will last until the end of March, till April 1st. During that first window, every American in every state, providing they open the exchanges in all these states, we know 26 are saying no, right? But the federal government will come in and do one anyway. They'll have that period of time where they can get health insurance. If you get past April 1st and you have a pre-existing condition, you will not be able to get access to coverage for pre-existing condition as an individual.
Through Obamacare. But there's still HIPAA laws where people can still go to the open market.
On group only. Individual people who don't have an employer-sponsored group plan, starting 4/1, if they miss that initial open enrollment period, they will not be able to get coverage for pre-existing conditions until the next open enrollment period, which will be 10/1/2014, and it will end on 12/31/2014. So every year we're going to have an open enrollment period for all Americans.
But Steve, I have a question for you. You've told me that you have gotten people with pre-existing conditions health care insurance. Is this being taken away now?
Yes, the state risk pools that we had are going to be absolved into the exchanges, okay? So we will not have state risk pool options any longer. All of that's going to be absorbed into the exchanges. Now, the problem is adverse selection. What is adverse selection? Adverse selection is insurance companies insuring people where they are not aware of all the risks. So waiting till you get sick to buy health insurance is adverse selection, all right? That's still going to happen. Because the intent of this law was to what? Pull all the young people in. All those young invincibles that aren't insured. It's cheap to insure them, and if we bring all these young people in, then the cost for health insurance for everybody who's already in, the older people paying higher premiums, it's going to go down, right? So we're going to force them to buy health insurance via a federal mandate. Pay or play, right? Play or pay. Here's the problem. 2014, the fine for noncompliance is 1% of your annual income. By 2016, it graduates to 2.5% of your annual income. I've run the numbers. You have to make $134,500 a year before the cost of health insurance in the exchange for a single person is actually cheaper than the fine. So how are you going to get all those people into the risk pool? You're not. They're going to pay the fine, especially since you can't be assessed a fine for 5 months out of the year. If you go uninsured for 5 months out of the year, there's no fine accrued. So how are we going to force these people to get in the exchange? You're not.
And a lot of these people aren't even getting jobs right now anyway.
No, because why?
Because these are the ones that are getting out of college.
Because 30 hours or more, the employers have to pay the $2,000 fine. So the employers are pushing them under 30 hours, which makes them what? Not only making less money, but now qualifying for what? Medicaid. We're already worried about putting 17 million people onto Medicaid. Imagine all these people are now working for Walmart, these other companies that are pushing them under 30 hours. Now their income is so low that they're not going to get health insurance like the president promised. They're getting welfare.
Steve, tell me, what does this mean? What does the impact of all this mean for the states?
Okay, so if we allow Medicaid to expand the way the administration wants it to be, where you just put them auto-enrolled onto Medicaid, all right? There are people, about 14, 15 million people in this country, that were eligible for Medicaid all of these years. They just never bothered to enroll, okay? Now, instead of not letting them enroll or them not being involved in the process and accessing Medicaid, we're now going to be forcing them, of course, by the mandate, depending on their income level, to come on into Medicaid.
What if they don't want to?
Doesn't matter. You have the federal mandate.
My father doesn't want to get on Medicaid.
He would go to Medicare, your father. I'm talking about Medicaid, the organization for the poor, the health care program for the poor. Okay, so they're all going to come on. It's going to cost states a lot of money, obviously. The difference that we should be doing as conservatives, and this should be our message going forward, we will never recoup the money we have spent to adopt these health insurance exchanges, okay? And if you remember a key point in Paul Ryan and Ron Wyden, who heads up the Gray Panthers from Oregon, who wants socialized medicine, he and Ryan came together before the election, okay, in 2011. They replaced the Ryan-Rivlin plan, which was written by Ryan and Alice Rivlin, which is Clinton's advisor. They replaced that, removed vouchers,
Okay.
offered what's called a premium assistance program. And they offered seniors in 10 years from today to have access to traditional fee-for-service if it's still there. Okay, the Centers for Medicare and Medicaid Service Chief Medicare Actuary says Medicare will be bankrupt by 2016 unless something is done. So what Barack Obama did is he cut $716 billion initially from Medicare.
Right.
In total, it'll cut $4.95 trillion from Medicare, Obamacare, $4.95 trillion according to the Chief Medicare Actuary. But just the initial cut of $716 billion to hospitals, home health care providers, right? Home health care clinics, that cut to Medicare Advantage as well, extended the life of Medicare until 2023.
It's kicking the can down the road.
Kicking the can down the road. So Ryan's solution was, listen, we know Medicare is going bankrupt. Both Ron Wyden and I know. So in 10 years from today, if you're 55 now, 10 years from today, we're going to give you access to fee-for-service Medicare if it's still around. We're also going to open a health insurance exchange, which is exactly what the president is doing for people under 65. We are going to have a sliding scale based on income. You'll be guaranteed the 2 lowest price plans, but there will be a sliding scale as to what plan you can get, but it will be offered by the private health insurance industry. This was their proposal. We as conservatives, our message until the next general election should be, we'll never get the money back for the exchanges. Let's use the exchanges to save the life of Medicare. Let's means test Medicare, so that we're not providing Medicare to Jack Roser when he doesn't need it, or to Warren Buffett, or to Bill Gates. Means test Medicare. Currently, it's illegal to opt out of Medicare without forfeiting all of your Social Security benefits. So fix that, and then most importantly, Medicaid. Mike Beebe is a Democrat, and he's from the state of Arkansas, okay? Mitch Daniels asked for a waiver from Obamacare from the Medicaid expansion, the maintenance of effort requirement, because he had reformed Medicaid all by himself by doing a program called Healthy Indiana. And what he did is he took his Medicaid recipients from a bankrupt, broken system, which is what Medicaid is, and gave them health insurance plans, which the taxpayers subsidize, okay? He used that same money that was given to him to buy them health insurance. Now the poor people in Indiana are not stuck in a bankrupt program. They actually have the same dignity walking into a hospital as anyone else does, carrying a Blue Cross Blue Shield card or any other carrier. We're subsidizing that as taxpayers. We can do the same thing for Medicaid across the country, and it was just approved in Arkansas to Governor Mike Beasley.